Welcome to Cybersecurity Awareness TV, episode number 405, recorded September 3rd, 2022. My name is Mac Jackson Jr. I'm a cybersecurity consultant and researcher. If this is the first time you have seen our show here, I discuss cybersecurity awareness news, techniques, and interviews that you can use to help protect yourself from the fastest growing crimes of the 21st century. I would also like to thank all of our viewers from around the world to help support us here on Cybersecurity Awareness TV with the WWDBTV network on Roku, in supporting us and being a part of our organization here. You can find more about my show and what we do here on Cybersecurity Awareness TV by going to my website at macjacksonjr.com. That's macjacksonjr.com. You also can be a patron by going to our Patreon channel at patreon.com/macjacksonjr. Remember to like, subscribe, and hit that subscription button, folks, to keep contact with us so you can find out everything that's going on regarding cybersecurity awareness. In this episode today, we scan the nation looking for cybersecurity stories related to the healthcare industry and how it is under siege from data breaches from hackers. Folks, this is a very, very serious issue that we will discuss in this episode, and things that you should know to protect yourself from these types of cyber crimes. Folks, cybersecurity awareness is something we all should be concerned with, and especially in the healthcare industry. Now, the commercial industry, they're also hit very hard with cyber crimes, including ransomware, but it's usually financial gain and money and holding back databases. Now, within the healthcare industry, we're talking about harm. Yes, life and death that can affect patients' health related to cyber attacks. That's why it's so important that we stay aware and informed of these types of cyber attacks. Here in Nevada, the Nevada Hospital Association says that the rise of cyber attacks is a major concern for all Nevada healthcare providers. I have a story to report to you that I was part of with local News 3. Check this out.
A new kind of virus is sounding the alarm.
Yeah, News 3's Lauren Clark is joining us now live from UMC to share why cyber attacks are becoming a growing problem.
Well, Latoya and Jim, it's part of the world that we live on right now. So much of what we have is online or on computer systems, and some hackers are really trying to cash in on that, finding a very lucrative target: you or your family members' personal health information, even medical devices.
It's becoming a thriving business for hackers around the world.
Cybersecurity professional Mac Jackson Jr. says it's a sick trend for hackers, preying upon data in hospitals.
They will lock up their patients' information systems where doctors and healthcare workers cannot have access to their data unless they pay the ransom to do it.
It's such a problem that several government agencies like the FBI and CISA sent out this alert to the healthcare industry, warning them that North Korean state-sponsored actors are targeting their data. And this weekly update from the Nevada Hospital Association shows it's a concern here, too. While COVID is slotted as no concern, cybersecurity is classified under a state of warning, citing that nationwide, the healthcare sector experienced a 69% increase in cyber attacks from this time last year. But why?
Simply put, it's because of life and death.
Jackson says it's because hospitals are full of valuable data, social security numbers, addresses, and medical information that could be sold on the dark web. And even more disturbing,
the equipment that are being used, right? Heart monitors, IV pumps, all of these work on the internet, and hackers are now hacking into these devices.
All the reason, he says, that hospitals are eager to pay up ransoms quickly.
Now you're talking about locking up data to protect a patient's life. That's where hospitals are, they will pay the money.
And hackers, he says, are catching on to just how lucrative this can be. So far this year, 304 data breaches have been reported nationwide, averaging over $10 million in damages for each impacted organization. It's why Jackson says now is the time to take this threat seriously.
It's always through education, training everyone in the organization, from the front desk person up to the CEO.
And of course, we wanted to know how hospitals are treating this situation and how they're going to assure you or a loved one that your personal information will be protected. We reached out to several today. Only UMC responded back. This is a statement that they sent us. It says, in part, UMC works alongside trusted partners to ensure our systems remain actively monitored 24/7 while rapidly investigating any and not anomalies to support the highest possible levels of data security. Reporting live here at UMC, Lauren Clark, News 3.
And thanks again for News 3 here locally Las Vegas for that interview. It's very important that we get this information out on a national basis to let everyone know and stay informed of these types of cyber attacks. Our next story, we will take a look at how these threats of ransomware has affected other healthcare providers across the country. Folks, information is the new currency. Our personal information in databases is the prize for these cyber hackers. This information is gained from these cyber attacks by exploiting databases and then taking this data and selling it to other bad guys within the darknet. However, folks, again, the hospital industry and hospital providers gives a different twist. This is a life and death twist, folks, that can affect the lives of patients that are there in the hospital facilities. Our next story, we'll take a look at investigative TV talking about data breaches and how it affects the healthcare industry. Check this out.
Well, imagine if your most personal information was potentially exposed to the public. Our national investigative team found while hospitals struggled to combat COVID-19 in 2020, cyber criminals were infiltrating healthcare systems, demanding ransomware, and jeopardizing patient information. We have the breakdown on patient privacy, and we'll show you how tens of millions of people across the country may have had their medical records compromised.
We don't yet know how many patients have been affected.
When you see this kind of news report pop up on your TV screen,
but it's unclear when a hack might have occurred.
You may ask yourself,
knew they had been breached.
Is it me? Because if you're a victim of a medical data breach, your information becomes valuable. A treasure trove for cyber criminals. Our national investigative team discovered that over 800 healthcare breaches were reported to the U.S. Department of Health and Human Services in all of 2019, 2020, and part of 2021. 52 million people had their medical records compromised. Since the pandemic, the number of breaches has skyrocketed. In the first 8 months of this year, the numbers already surpassed all of 2020. And this year's numbers are 8 times higher than what was reported in 2019. Even though this impacts a lot of people nationwide, finding a victim to talk to for this story proved very difficult because they either didn't know about the breach or filed class action lawsuits with agreements prohibiting them from talking to us. But former hospital administrator Robert Goff did speak out. He faced 2 healthcare breaches after employees opened suspicious emails, forcing the hospital to pay millions to stop a ransomware attack.
That means that your operating system, your medical records, are not electronically available as you're providing patient care.
Goff said the hospital had the latest technology and security measures in place to prevent a hack, but it still happened, putting patient safety and treatment at risk.
Depending upon the hospital and the system, how fast can you get to your backup information and bring it online? It's generally not instant. There are some hospitals that indicate that clinical care was impeded and that there had been some fatalities.
Goff told us the hospital had no deaths, but he couldn't say if patient information ended up in the hands of cyber criminals. But the hospital staff is constantly training and re-educating employees on cyber attacks.
We do our own phishing attacks on ourselves. And unfortunately, if an employee has a habit of clicking on everything and does not change with education, we would be forced to terminate them.
Under HIPAA, healthcare organizations are required to report a breach to the Department of Health and Human Services, Office of Civil Rights, if more than 500 people are impacted. Our research shows the type of medical breaches tracked by the federal government. Out of 827, 3/4 of those breaches involved hacking. The 10 largest data breaches over the last year involved nearly 19 million records. We found the companies with the largest breaches include a corporation which administers government health insurance for kids and a major grocery company.
It's sad because look at all the people being victimized.
Right now, it's just the Wild West. There are no rules at all.
Texas Representative Michael McCall co-chairs the Congressional Cybersecurity Caucus, created 15 years ago to raise awareness of an evolving threat.
We have to have some rules of the game in the international space. The legislation I have on the Foreign Affairs Committee would set up this office within state, an ambassador that could negotiate with, say, our European partners, our NATO allies, that NATO is going to stand together.
Virginia Congresswoman Abigail Spanberger introduced the Better Cybercrimes Metric Act to help law enforcement go after hackers attacking victims nationwide. The bill hasn't passed.
The protections we have in place, is it enough? Can we do more?
We can absolutely do more. Quite frequently, we'll see that companies or entities will pay whatever sort of extortion demand is made by these criminal groups or criminal entities.
The sooner the breach is contained, the lesser the damage will be.
Which is why cybersecurity expert Vahid Bezadon urges you to report any cybercrime and take steps to protect yourself by changing your passwords, getting antivirus protections, checking for computer updates, and reporting any weaknesses in the system.
Should we worry about this?
All the time. You should worry about data compromises anytime that you provide or store information about yourself on the internet. You should be aware of the risk.
Now, according to the latest data breach report by IBM and the Ponemon Institute, the average data breach in the U.S. cost $9 million in 2021, with the healthcare industry paying the most per data breach. For Investigate TV, I'm Sandra Jones.
Our next story continues, spanning our nation regarding healthcare industry stories regarding cyber attacks. The facility in San Diego has been exploited with a cyber attack that caused a disruption in patient care. And it has something that has shocked the city of San Diego that we will discuss here in a few minutes here. But first, companies that have these types of cyber attacks are mandated to report that they were a cyber attack to all their patients within a certain period of time. And it's hard for companies to actually report this information to their patients because now you're giving your patients some additional concerns, not just for their health, but now for their personal data. But they are mandated by state regulations and federal regulations that they must report these cyber incidents to their actual patients as well as to law enforcement. In our next story, we will take a look at a story from CBS News 8 in San Diego regarding medical data breaches. Check this one out.
Patients and employees of Scripps Healthcare are worried about the impacts of a cyber attack that took place more than a week ago.
There's still a lot of questions tonight about what happened. News 8's Elizabeth Sanchez spoke with a security expert who has some advice for patients.
Patients we spoke to say they're not being told a lot about what exactly happened regarding the Scripps cyber attack. They want to know what information was taken, and they say it can be really frustrating.
Cyber attacks are up. In fact, security expert Caleb Barlow says 66% of healthcare companies cannot meet the minimum security standard defined by the National Institute of Standards and Technology.
The problem here is we have an industry with a rapidly growing technical debt. And it's not that they're not investing in security, they are. They're just not investing fast enough to keep up with an ever-moving adversary.
A Health and Human Services report on healthcare security listed the vulnerabilities in hospitals. They named networks without tight controls, how records are disposed of, the use of personal devices, and working from home.
And often, too, you don't see multi-factor authentication in place. And many of us are familiar with that, where, you log in with a password, but then you also have to get a challenge and response on your phone.
That extra step can keep cyber criminals out of the network. Scripps Healthcare is saying very little about its security measures and only issued a written statement saying the network outage was caused by malware. But they haven't said how that happened. We have learned the cyber attack took all Scripps hospitals out of the emergency medical response system on May 2nd when a boat capsized off Point Loma. Scripps Memorial Hospital in La Jolla was the closest trauma center to the incident, yet patients were sent to other area hospitals. It's the kind of disruption cyber criminals want.
It's always unsettling when you hear that your security has been breached because I don't know what information they have and how they might use it.
Lisa Kendall's daughter's appointment was canceled, and like so many others, she's forced to reschedule it. But the lack of information from Scripps is leaving many with questions.
I don't know what to do about it, other than just make sure that I'm following my credit monitoring apps and make sure that nobody's trying to get our information. But I feel helpless.
Now, the security expert that we spoke with says this has been happening again and again. He told us about a number of healthcare industries that this has happened to. He says it's a problem that the country is going to have to address. Elizabeth Sanchez, CBS 8 News.
Folks, our research continues with more stories involving data breaches for your personal information. Healthcare facilities nationwide are reporting these incidents to law enforcement. And again, law enforcement has stated that healthcare industries are the highest number of incidents of cyber attacks and data breaches. Hackers, where they come from? Hackers have come from nation states, organized gangs, disgruntled employees within a facility, as well as the insider threat. All of these are elements that are the human factor, folks, that can compromise data and cause instances of cyber attacks. It is important that we stay informed and aware. Our next story, we travel across the country to CBS, Dallas-Fort Worth, Texas. Here's our story.
Welcome back, everyone. You know, it's a problem that we continue to hear about, data breaches involving your personal information. The latest one reported to the Texas Attorney General affects more than 1 million Texans, and you could be one of them. I-Team reporter Brian New with what you need to know.
It's not the first, nor will it be the last, but the data breach reported this week by the Texas Attorney General's office is the largest since Texas began requiring companies to report them. Jefferson Dental, which operates more than 70 offices across the state, reported being hit with a malware attack in August. The company reported Social Security numbers, driver's license numbers, health insurance information, and financial information may all have been exposed or taken. Jefferson Dental has mailed out this notice to more than 1 million of its patients. A letter cybersecurity expert Gary Davis fears most will likely ignore.
There's just so much noise about this space that consumers become numb to it. They just figure, well, they got my information. At some point, I'm going to have to do something about it, so I'll just wait till that happens.
But Davis says by then, it's often too late, and it could be years before stolen personal information is even noticed, especially when it comes to children. On the dark web, data sets with children's personal information have become a hot commodity. Cyber criminals often use child data to create what's known as a synthetic identity, using unchecked Social Security numbers belonging to children.
So yes, it matters. I just wish there was more. I wish we could have this rise above the noise and have consumers really care more about it.
So the advice for adults is check your accounts and freeze your credit. As for your child, you're going to want to see if they have a credit. And you would do this the same way that you check your credit with the 3 major credit reporting agencies. And if they do have a credit, well, that's a sign their identity may have been stolen. With the I-Team, Brian New, CBS 11 News.
Folks, in our next story, we'll travel up north to Michigan, where hackers have compromised personal information of residents of the state of Michigan. Folks, these hackers are relentless in looking for data. Why all over the state? And all over the country? Because hackers look for information they can gather from every database that they may find from different servers that they can break into. And they can connect these databases by your Social Security number, your driver's license, your personal information to build a profile about you that can be sold to other bad guys in the dark net to exploit your citizenship, to do illicit acts within your name using your identity. Again, folks, we must stay aware and protect ourselves. This story regarding Michigan comes from WDIV News 4 in Detroit.
We've been telling you about a massive data breach affecting thousands here in Michigan. Now it's getting the attention of the Attorney General. The breach involves the Detroit-based Wolverine Solutions, and it may have compromised the personal information of more than 600,000 people. Our consumer investigator, Hank Winchester, joins us. And Hank, what types of personal info are we talking about here?
Karen, we're talking about a lot of personal information: names, addresses, dates of birth, Social Security numbers, phone numbers, and private medical information. So here's what you need to know now to protect yourself. The data breach is massive, more than 600,000 affected here in Michigan, and including customers of Blue Cross Blue Shield of Michigan, Health Alliance Plan, McLaren Healthcare, Three Rivers Health, and North Ottawa Community Health Systems. Personal information exposed, and we all know how concerning that can be. Matt Loria, CEO with Oxium, his company works to help others build rock-solid IT networks to prevent against these problems.
It was a ransomware attack where some nefarious creatures got in there, locked down some files in the servers and perhaps even in the workstations, and then held those for ransom, and then contacted the company and saying, hey, we've locked down your files with an encryption, and if you want them back, you have to pay money to get that.
Data breaches becoming more common. Your personal security, and in this case, personal medical information now out there for thieves to get.
Not only do they have your name, phone number, address, but they actually have some really pertinent and detailed health information on you. So, that's just other ways that someone can identify to really impersonate you.
The AG recommending that you first see if your information was compromised. Pull your credit report. Look to see if there's any suspicious activity. It's really up to you to protect your personal info moving forward.
Because this is impacting individuals, not just companies, I would recommend that they freeze their credit, especially if they get the letter stating that their name was, or their information was something that actually did get compromised. I'd also sign up for the free credit monitoring service that they're offering to those that are affected as well.
Now, we did receive more information and advice from state investigators. I want to read part of a statement. Wolverine is offering 2 levels of identity protection to individuals affected by the breach. If you received the letter from the company, we urge you to carefully consider enrolling in the free credit monitoring service. We will continue to follow this breach and keep you updated. Devin?
Amazing, folks. In our last story, we will talk about the East Coast, folks, where 1.4 million people have their personal information at risk from a data breach. This report comes in from the Carolinas. Again, folks, protect and stay informed of these types of cyber attacks. This story comes to us from WCNC from the Carolinas. Here's the report.
New tonight, a Where's the Money investigation. Throughout the pandemic, patients have put their trust in hospitals, health plans, and medical providers.
Yes, but as medical staff worked tirelessly to save lives, the healthcare industry couldn't stop hackers from causing a record number of security breaches. And criminals aren't just getting a hold of medical data, they're also getting into that personal and financial information as well. Our Nate Morabito found nearly 1.5 million people impacted in the Carolinas alone since 2020.
We've learned the federal government is investigating more than 24 healthcare data breaches right now with origins in North and South Carolina, including cases involving well-known hospitals, health plans, and medical providers. Take it from someone who's received one of those dreaded letters.
I've never felt like it could happen to me.
When hackers capitalize on a healthcare company's vulnerability, it's the patient who risks losing the most.
We can't rely on them to keep it safe.
The problem is that a lot of the systems that we trust, they get hacked.
Dr. Mohammed Shihab is a software information systems professor at UNC Charlotte.
The question is not if you are going to be hacked or no. The question is, when are you going to get hacked?
He says no matter how hard the healthcare industry works to secure networks and detect attackers quickly,
the weakest link in all of this is the user.
Hackers can always count on human error. Some of the biggest names in healthcare are on this list, under investigation by the federal government for breaches involving unsecured protected health information, victims of hackers, unauthorized access, and even theft. Office for Civil Rights data show healthcare companies in the Carolinas have reported breaches impacting at least 1.4 million people since 2020. When you hear that number, what do you think?
It's a very big number.
Dr. Shihab says the pandemic has made healthcare data even more desirable, used for ransom leverage, to sell on the black market, and for malicious reasons. And it's especially problematic since these companies are entrusted with employee files, financial information, and patient health records, which detail your family's private medical battles.
The problem with this kind of data, especially health data, it doesn't only affect you, it affects you and your relatives.
In light of the growing threat, he recommends patients only give what's absolutely necessary.
So basically, try not to release as much information about yourself in the system.
For your online medical accounts, he recommends two-factor authentication.
It adds another layer of defense.
And is a big believer in low-cost or even free password managers that create long random passwords for you, so you only have to remember one. And so it's more difficult for hackers to make you their next victim.
A congressional report released just last month identified 8 healthcare companies, including one in North Carolina, fined a combined $13 million following federal investigations in 2020 alone. In hundreds of other cases, meanwhile, the government required corrective action aimed at preventing future breaches. Nate Morabito, WCNC Charlotte.
Certainly an eye-opening report there from Nate. And by the way, if you do want to check and see if your healthcare provider was in this breach, you can log on to our website, WCNC.com. We have a feature where you can search by the company's name. So once again, go to our website, find Nate's article right there on the homepage.
Folks, as you can see, data breaches and ransomware are on the rise. More and more businesses must be proactive versus being reactive. In other words, they need to prepare themselves now for the what if rather than the when it will happen, and prepare themselves, becoming proactive against these cyber attacks for their business. The proactive approach, folks, is the best way to discover vulnerabilities within your organization and fix them before the hackers be able to find them. Folks, like we always say here on Cybersecurity Awareness TV, hashtag stay cyber woke, folks. We'll be right back after these messages. Hello, folks. This is Mac Jackson Jr. from Vanderson Cyber Group. The problem with businesses today is that they are affected by cyber attacks from around the world, but companies are not sure of what to do. Normally, they are reactive instead of proactive. But folks, cyber attacks can affect your bottom line and will affect you financially, legally, and your business reputation. Here at Vanderson Cyber Group, we can help you develop a policy by training your employees on what to do if they are involved in a cyber attack and how to mitigate it and fight against it. Folks, we call it here hashtag stay cyber woke. And that's Vanderson Cyber Group here in Las Vegas and around the world. You can reach me, folks, at VandersonCyberGroup.com or my website, MacJacksonJr.com as well. Here locally, 702-868-0808. Give us a call today, folks. We must fight back. Hi folks, welcome back to Cybersecurity Awareness TV. I'm your host, Mac Jackson Jr. In this segment, we talk about, so what can we do? What can you do to protect yourself and your business from these cyber attacks? Folks, like we say every week, where does it start from? It is a human factor. Yes, that's right, folks. The human factor is our weakest link when it comes to cyber attacks. But there is something you can do. We could start by our passwords. Our passwords that we use to access information and data, our own personal data online and internet. You make sure that you have a strong password, folks. And I don't mean folks like password 1234. No, you must have a strong password set up in your system. If you're not sure of how to create a password, there are some other things you can do. You can contact my company and we can provide you training and consulting services on how to set up and maintain a proper password in your business. Nothing's guaranteed. The hackers will always find a way to go around your password that you're utilizing, but having something there, folks, is best to have some protection versus having nothing at all. So make sure you have a strong password and use a password manager. Password manager will be able to save all of your passwords that you use, and it will remember them for you, and you use and launch your password management software on your browser when you're needing to access a website. Do not write down your passwords on a piece of paper, and folks, I would not even suggest having them written down or typed out on a spreadsheet, because if that spreadsheet is stolen, you've actually created currency, folks. That spreadsheet is worth thousands of dollars to hackers in the darknet that want that information and data. Have your information Encrypted is the best way of protecting you. These are just some of the things that you can do. Again, when you travel, make sure that you have a VPN set up on your smartphone, your laptop, your smart device, making sure it's protected. Making sure that you have all the updates that are sent to you by your manufacturers of your computer system to make sure you have all the updates on your hardware and software devices. These are just some of the things you can do, folks, to protect yourselves. And again, if you'd like to find out more, definitely contact my company, Vanderson Cyber Group. That's Vanderson Cyber Group at VandersonCyberGroup.com for information on how to create policies internally for your organization. Again, folks, it's the human factor that's a part of all this. The human factor is a way to guide and protect your business from these types of cyber attacks, because we make mistakes. We're human. We make mistakes. We'll see an email that we'll click on thinking it's from someone that we trust and it's safe. And it turns out it could be a cyber attack. Hackers are also using text messages from your smartphone, sending you smart text messages, and you'll click on, and it will direct you to a nefarious website. All of these techniques, folks, are what we do here with my company, is that we study these types of attacks with law enforcement and provide training to your organization to protect you from these cyber threats. I definitely would suggest to you, if you can't get a hold of my company, find a local cybersecurity reputable company in your area and make sure that your employees are trained, folks. Like we say every week on the show, Cybersecurity Awareness TV, our best defense is through education. That's it for this week, folks. We hope that you will take our message and share it with other people and let them know how to protect themselves from these types of cyber threats. Until next week, folks, #StayCyberWoke. I'm Mac Jackson Jr.